I have moms who are so anti-vax, and I see that they drank soda pops during the entire pregnancy. And let me say that slipped disc it's not a real term. This vasoactive intestinal peptide acts as a neural communicator. We do know that eating less calories is connected to longer lives. Now, one of the questions is it also connected to more frailty? And the reason is it because it blocks myostatin. So think about muscle statin.
Welcome to our Q&A highlights. Q&A sessions are recorded every month, and our enhanced members get an exclusive opportunity to ask questions from one of cellular medicine's brightest minds, Dr. Elizabeth Yurth. Get a chance to ask your questions by becoming our enhanced member at bli.academy/memberships. You also get access to our content library full of tips, articles, videos, lectures, previous live Q&A sessions, and more.
Are there different effects from subcutaneous versus intra-articular, that means inside the joint, injections of pentosan polysulfate for joint degeneration? So intra-articular injections have been successfully done in horses, and they actually use this drug intra-articularly in horses. In humans, there's a very high risk of creating what we call hemarthrosis, which is bleeding inside the joint. And believe me, this is a bad thing. It's extremely painful to have blood inside your joint. So when you get a hemarthrosis, when you get blood inside the joint, either from trauma or somebody doing an injection, then it is horribly painful. The blood collecting in the joint, unless you drain it all out, can be damaging to the cartilage. So bad thing. I don't risk it. I don't think you should inject this intra-articularly in humans. You have to remember that when they looked at studies, 75% of us, asymptomatic people, when we did MRI scans, had slipped discs. And let me say that slipped disc it's not a real term. You can have disc damage, which is a progression where you can have just a degenerative disc. The disc kind of loses height, it loses volume. You can have damage to the wall of the disc, called the annulus, where the wall tears, and you have sort of what we call annular tears, which are little tears in the outer wall of the disc. You can have a protrusion, which is where the outer wall now allows it to bulge out, or herniation, where the guts of the disc, the inside of the disc, what's called the nucleus, comes outside of the annulus. So follistatin, when we age, we get a decline in bone and muscle, and it's partly because of the changes of expression called something called activin A and myostatin in the body. And follistatin is probably the key here. So follistatin, we naturally make it in our bodies. And it plays a role in both inflammation, reproduction, embryo implantation, and muscle building. Follistatin 315 is the main form of follistatin that's found in the bloodstream that targets muscle. So when we think about supplementation with follistatin, it's usually 315 that we want to supplement for, not 344. We want the active form that's in the bloodstream that's really working on muscles. Follistatin's been really popular among the elite bodybuilders for quite some time. And it's because it definitely helps to build muscle at a faster rate. And the reason is because it blocks myostatin. So think about muscle statin, stop. So basically, you stop muscle from forming. So follistatin will help block the myostatin, and that allows you to keep building muscle. There's these bulls that you guys have probably seen pictures of, these Belgian blues, they're called, and they're gigantic. They're just rippling with muscles. And it's because they have a genetic mutation in making myostatin. So they don't stop building muscle. They just form massive amounts of muscle because they have this genetic mutation, right? Well, in humans, we have a lot of myostatin to keep us from getting quite as hugely muscular. So if I block the myostatin, I can get much more huge and muscular. And follistatin does that. Again, you make it naturally. So by giving yourself more, is that going to be better? Probably, especially because it does seem to decline as we age. So I'm not an anti-vaxxer by any means, but do I think that there's correlation between vaccines and some childhood disorders and adult disorders? I do. And I think it has to do with the ability to detox. We all detox differently, right? And so depending on what your ability to detox these different things, like mercury or formaldehyde as adjuvants, could they potentially have an adverse effect? Most definitely, yes. Also remember that before a baby's even born, they're exposed to about 200 different toxins. So your baby at birth has so many toxins. And so if the mother, for instance, is living in a big city, so is exposed to a lot more environmental toxins, or the mother is really not doing a lot to take care of herself, or is eating crappy food, things like that, that baby is going to be born with a higher toxic exposure, right? So now they're trying to detox all these toxins that they unfortunately were exposed to before they're even born. And then we add in more toxins on top of it, and that's going to create even more problems. I think that before your baby's born, you need to make sure that you are well detoxed, right? And you make sure that you're doing things, living very healthy, and you're eating healthy, and you're not exposing yourself to as many environmental toxins. I think that's critically important. I think we forget it. We put all this emphasis on vaccines and not a whole lot of emphasis on teaching mothers not to be exposed to these toxins that they've just transferred to their child. I have moms who are so anti-vax, and I see that they drank soda pops during their entire pregnancy. I think that that's counterintuitive. I think the big thing is you've got to limit the amount of exposures to toxins. The present vaccine schedule does a whole lot of vaccines at one time very early, and I don't think that's a good idea. I prefer more of a delayed vaccine schedule, so you're not starting vaccines until maybe more like the 2-month age, and that you don't give them more than about 2 at one time. We kind of never think about oral health and hormones, right? Like you think about hormones for all these other things. Certainly think about them from cardiovascular and brain and sex drive and muscle building. We don't think about them for oral health, and yet we hear over and over again that oral health is critical to longevity, right? And then we ignore the fact that hormones are essential to oral hygiene. Now we know that falling estrogen levels, not only do you lose bone density, so your teeth start loosening because you don't have good jawbone, so you start to lose teeth, which is bad. You get much more gum inflammation because of the loss of some of the gum tissue as estrogen levels fall. And so you get loose, missing teeth, bleeding, pain, but also start making less saliva. So when you have less saliva, you get dry mouth, which is associated with a change in the whole microbiome in the mouth. And so now this dry mouth, people are trying to drink more water and things like that. That's not helping because your saliva is a critical piece of the microbiome. So keeping this salivary flow going in your mouth is really important. And so now women start getting, not only dry mouth, but a lot of conditions associated with that. We'll see burning mouth syndrome. I know Emily has a couple of patients with burning mouth syndrome, and that can probably be prevented. Once it starts, it's hard. It can probably be prevented if we keep hormones at a higher level. And nobody tells these women that, right? And so you're preventing this horribly painful disease, right? This burning mouth syndrome is bad. And then you can prevent that a lot by keeping salivary flow going and keeping estrogen levels high enough. I will say that vegans are at very high risk for a lot of deficiencies, B12 deficiency. So you have to make sure you're taking additional B12, some of the other B vitamins, omega-3 fats, very deficient omega-3 fat. It's very hard to get omega-3 fats just from plant sources, at least not without getting some of the more toxic seed oil plant sources. There are lots of plant foods that contain omega-3s, but not in the form. And we see the vegan diet people have, when we do prodrome scans, when I see people with vegan diet, they don't look good at all. I will tell you that. And I don't think Brian's done a prodrome scan on himself, but I tell you, they do not look good on a prodrome scan, which concerns me over overall longevity in terms of things like your brain. It's also really hard to get enough protein from muscle. And so I think that over time there is muscle loss, unless you really have a really good person who is really legitimately planning things out really well for you. Circadian rhythm disruptions are huge. As we get older, our circadian rhythms get disrupted, but also travel, right? You travel, to Asia, or like Zora from Hack My Age, she travels around the world. So you're always in these different time zones, and your circadian gets very, very disrupted. Or even the time change when we go, our fall back, spring forward, that disrupts our circadian rhythm. So when we look at LL37, we use primarily for viral illnesses or infections. VIP, on the other hand, vasoactive intestinal peptide. Now, both of these are peptides your body just naturally makes. So VIP is a neural peptide. It's actually made by the gut. It acts as a chemical messenger. So this vasoactive intestinal peptide acts as a neural communicator. It's secreted to keep our body so that the liver is working at the right time, and the kidneys are working at the right time, and the brain is working at the right time. We most common use epitalon, or Pitalon, however you want to say it, epitalon as our circadian reset. It's a pineal peptide. Remember, the pineal gland is one of the prime things that sort of starts to calcify as we get older. And it's one of the things that really seems to play a role in why circadian rhythms get disrupted as we get older. So for those who don't know, 5-amino-1-MQ is a peptide that blocks an enzyme called NNMT. And this is a key enzyme that slows down fat metabolism. And it makes it difficult for fat cells to burn accumulated fat. So you get more weight gain when NNMT is activated. Contributes to chronic diseases like type 2 diabetes, cardiovascular diseases, cancers. And we know that NMT is a really pivotal role in the cellular energy balance. So when we get fatter, the fat cells make more NNMT, encouraging more fat and more metabolic dysregulation. And so by blocking NNMT, which you can do with 5-amino-1-MQ, you can correct this problem, right? So basically, you correct the fat cell metabolism by not feeding them any NNMT, and the fat cells shrink and you lose weight. I think there's no doubt at this point that there's very strong evidence to support caloric restriction as one of the most proven things that you can connect to longevity. So we do know that eating less calories is connected to longer lives. Now, one of the questions is it also connected to more frailty, right? So you live longer, but you're more frail, you have less muscle, and maybe some cognitive decline. We don't quite know the answer to that. But I think there's evidence to support. I think a lot of us eat too many calories. And probably what you want to do with caloric restriction is wax and wane through it. Go through more restricted protein periods and then high protein periods to build back up. What I always advocate is this sort of cycling of higher protein build up phases and then lower protein. And I think that is probably one of the better ways to think about this in terms of longevity. And it's also more doable than always just eating a very caloric restricted diet. One of the hard things about caloric restriction is getting enough protein for muscle building. So if you're caloric restricting, trying to eat 100, 150, whatever your 180 grams of protein becomes very difficult. And that's true of time restricted eating as well. So I think you want to cycle these things when you're doing them. So cycle periods of lower calorie, lower protein, and then higher calorie, higher